Welcome to all of you once again. In the lesson which deals with amnestic disorders, in our earlier session we have talked about what are amnestic disorders. We had an overview of what amnestic disorders are. We have also talked about specific amnestic disorders like cardiovascular disorders and vascular dementia. Today in this session we are going to talk about two disorders which are Korsakoff syndrome and epileptic disorder. We will first talk about Korsakoff's syndrome. Korsakoff syndrome is a brain disorder usually associated with heavy alcohol consumption over a long period of time. It's a chronic memory disorder caused by severe deficiency of what is called thiamine, vitamin B1. Though it is most commonly caused by alcohol misuse, certain other conditions can also cause the syndrome. You are seeing here the picture of Korsakoff. He is the person who has named this syndrome. It is, as I said, caused by a lack of thiamine, that is vitamin B1, which affects both the brain and the nervous system. People who drink excessive amounts of alcohol are often thiamine deficient. Thiamine or vitamin B1 helps brain cells produce energy from sugar. When levels fall too low, brain cells cannot generate enough energy to function properly. As a result, Korsakoff's syndrome may develop. This Korsakoff syndrome, as I said earlier, is most commonly caused by alcohol misuse, but it can also be associated, if you remember I said other conditions. What could these other conditions be? AIDS, chronic infections, poor nutrition and certain other conditions too. Before going into the details of Korsakoff syndrome, we have to talk about what is called Wernicke's encephalopathy. Wernicke's encephalopathy is a medical emergency which causes life-threatening brain disruption, confusion, staggering and stumbling, lack of coordination and also abnormal involuntary eye movements. Because the chronic memory loss of Korsakoff syndrome often follows this episode of Wernicke's encephalopathy, the chronic disorder is sometimes called Wernicke-Korsakoff syndrome. But Korsakoff syndrome can also develop in individuals who have not had a prior episode of Wernicke encephalopathy as well. This Wernicke encephalopathy and Korsakoff syndrome, how do they develop? Wernicke's encephalopathy can develop suddenly. To diagnose Wernicke's encephalopathy in a heavy drinker, a person who is a heavy drinker, a person must have at least 2 of the 4 groups of symptoms which I am going to talk about now. First is an evidence of undernutrition. The person must be very much underweight. The second is an involuntary jerky eye movement or eye movements or paralysis of muscles which move the eyes. Poor balance or unsteadiness or other signs of damage to the cerebellum. In addition, the fourth symptom group would be disorientation, confusion or mild memory loss. If when such symptoms are seen, if treatment is carried out in time, most symptoms should be reversed in a few days. If this Wernicke's encephalopathy with the symptoms which I have discussed with the help of symptoms that I have just described, if it is not identified and is left untreated or is not treated soon enough also, then Korsakoff syndrome will follow in many cases. And Korsakoff syndrome is likely to develop gradually. Damage occurs in important small areas deep within the brain, resulting in severe short-term memory loss. Many other abilities may remain intact, like for example, the working memory may be intact. What are the symptoms which are seen? The main symptom for Korsakoff syndrome is memory loss, particularly of the events which occur after the onset of the condition. For this reason, the term alcohol amnesic syndrome may sometimes be used by health professionals. In some cases, memories of the distant past can also be affected. Korsakoff syndrome causes problems learning new information. Remember, we have talked about it with reference to certain other types of dementia as well. Inability to remember recent events and long-term memory gaps too. Memory problems may be strikingly severe, while other thinking and social skills are relatively unaffected. For example, individuals may seem to be able to carry a coherent conversation, but a little later, a few moments later, if you ask him, he would be unable to recall that the conversation took place or to whom they have spoken as well. What could be the other symptoms? These are some of the prominent symptoms. Now, what are the other symptoms? Difficulty in acquiring new information or learning new skills also. Change in a personality. At one extreme, the person may show apathy. You know what is apathy, right? Unconcern, lack of emotional reactions constitute apathy. Or at the other, the person may be talkative and may have repetitive behavior. There may be a lack of insight into whatever the condition they are in. Even a person with large gaps in their memory, he may just believe that his memory is functioning pretty normally. Then there is what is called confabulation. What is confabulation? This is where a person invents events to fill the gaps in his memory. Just now we said that there may be long gaps, large gaps. Something has to be done in order to understand what has been happening in between. So they confabulate. They fill it with certain events. And this is usually more common during the early stages of illness. For example, a person who has been in a hospital for several weeks may talk very convincingly to someone about having visited his or her aunt earlier that day. This is how the symptoms are seen. Is there a treatment? Unlike Alzheimer's disease or vascular dementia, Korsakoff syndrome is not certain to get worse over time. Now, having talked about all these symptoms, what could be the possible treatment for Korsakoff syndrome? Unlike Alzheimer's disease or vascular dementia, Korsakoff syndrome is not certain to get worse over time. It can be halted if the person is given high doses of thiamine. Remember, thiamine deficiency is one of the important factors. This, if he abstains from alcohol and if he adopts a healthy diet with vitamin supplements. If thiamine, high dosage of thiamine, abstinence from alcohol and adapting a high healthy diet with necessary vitamin supplements, if all these are done, then it may not worsen. Any improvement usually occurs within a period of up to 2 years. It has been estimated that about a quarter of those who are affected make a very good recovery. About half make a partial recovery and need support to manage their lives as well, but may still be able to live in their own homes. A further quarter which is remaining make no recovery and generally need long-term residential care. Now let us talk about another important disorder, epilepsy. Epilepsy is a broad term. It covers a range of disorders. In all of them, however, the primary symptom would be recurrent seizures caused by a disruption of the electrical and physiological activity of the brain cells. This abnormal activity, which can usually be documented by EEG, which is electroencephalography, in turn disrupts the functions controlled by the affected part of the brain. What are the causes of epilepsy which we so often hear about? Any condition that interferes with the brain functioning, altering brainwave patterns, can cause epilepsy. This may happen at any time in life, beginning with prenatal life. People with severe seizures often have a history of trauma or anoxia at birth. What is anoxia? It is oxygen deprivation. But the most common cause is head injury, according to studies. This linkage is probably due in part to the fact that most cases of epilepsy have their onset during childhood or adolescence, which is a period in which there is a high risk of head injury. When epilepsy begins in middle age, a more likely cause here is brain tumor. When it strikes in older age, it is often due to one of the cerebrovascular diseases that old people are prone to, for example, stroke or cerebral arteriosclerosis, according to studies. Cases in which the origin of the seizures can be identified is called symptomatic epilepsy. More common in the general population, according to studies, however, is idiopathic epilepsy, in which the origin of the seizures is unknown. In many idiopathic cases, there is a family history of seizures, so genetic factors are probably involved. Once again, that's what studies say. Let us now talk about the types of seizures. We will start off with what is called partial seizures. Partial seizures originate in one part of the brain rather than in the brain as a whole. In a simple partial seizure, cognitive functioning remains intact. The person may experience sensory changes such as stomach trouble or a strange smell, or also motor symptoms on one side of the body. For example, the fingers on one hand may start twitching. Some people also report minor psychological changes such as hearing a tune repeat itself again and again in their heads. But even in the midst of the seizure, the person can still speak, understand speech, and can think straight. In a simple partial seizure, cognitive functioning thus may remain intact. You see in this picture two portions. On one portion, you see the face of a boy before the seizure, and the same boy's face is seen in the second portion of the picture, that is during partial seizure, jerking of the right half of his face, and here the patient is fully conscious. That was about simple partial seizure. By contrast, there is what is called a complex partial seizure, which is the most common form of seizures according to studies. This interrupts cognitive functioning, which was not there, if you recall, in the simple partial seizure. Such attacks may be often preceded by what is called an aura or a warning, which the person may be able to describe only in very vague terms. Like for example, the person may say, "It's a funny feeling that I had." He may not be able to describe to you properly. Then as the seizure begins, the person can no longer engage in purposeful activity, and he does not respond normally. What he or she does instead becomes very variable, highly variable. Some patients may fall into a stupor, others may engage in automatisms, repetitive purposeless movements like fumbling with their clothes, and others have been known to break into a run as well. But whatever the activity, the person is definitely not thinking normally, and neither can he or she speak coherently. Complex partial seizures usually last for more than 10 seconds. Often it may continue for several minutes also. There are sometimes what are called temporal-lobe seizures. Because they tend to arise in the temporal lobe, but they can originate in other parts of the brain as well. So far we have talked about partial seizures. Now there is another type of seizures called generalized seizures. While partial seizures begin and often remain in only one part of the brain, generalized seizures on the other hand, this is the second major category of epileptic seizures. They generally involve the entire brain at the outset. They are called primary generalized seizures. If they involve entire brain at the outset, then they are called primary generalized seizures, or soon spread from one part of the whole brain, which are called secondary generalized seizures. Let us first talk about primary seizures. Among the primary seizure types are what are called absence seizures. These were called earlier the little illness or petit mal. These attacks are usually seen in children rather than in adults. Absence seizures come without any warning and typically last only a few seconds. During this period of this absence seizure, children with these seizures seem to absent themselves from their surroundings. Their faces may take on what is called a spaced out look. They stop moving, they stop speaking, they will not talk, and if you talk to them, even if they are spoken to, they cannot respond. Then, as abruptly as it started, the seizure ends, whereupon some children remain confused, while some people, being unaware of what has happened so far, simply resume whatever they have been doing just before the seizure. Another very important type of seizure in these generalized seizures is tonic-clonic seizures. Tonic-clonic seizures are found both in children and adults. It's one of those generalized seizures. Sometimes it is heralded by an aura. These attacks typically begin with what is called a tonic or rigid extension of arms and legs. This is followed by the clonic phase or jerking movement throughout the body. The jerking diminishes only at the end of the attack, at which point the person usually feels confused and sleepy. Now, what happens is during this period, people can, some of them, they can bang their heads or otherwise harm themselves during this period of the seizure. So, what is usually done is hard objects should be moved out of the way so far as possible. The only other way bystanders can help people having such seizures is to move them onto their sides as shown in this picture, so that even if they vomit, the vomit should not back up into their air passages. This was once known as grand mal or great illness. They were called by this name earlier. Now they are called tonic-clonic seizures. They are the most dramatic form of epileptic attack. This picture shows the first aid for seizures. It can be generalized tonic-clonic attack, as we have generally talked about, like for example, making the person feeling comfortable, then loosening the tight clothing and turning them on the side, as we have just discussed. And just notice how much time it has taken, and very often people try to push something into the mouth which need not be done. And then of course, the other procedures of safety, like looking for the ID and not perforce pushing them or holding them down. And as the seizure ends, it is the social support which is necessary by the people around. So far we have discussed the types of seizures. Let us now talk about the psychological factors which are related to epilepsy. It is not just during seizures that epilepsy disrupts the brain functioning. Even between the seizures, irregular brain waves often persist, interfering with the concentration and learning of an individual. The most common complaint of people with epilepsy is that they have poor memories. This is due to the fact that most epilepsies involve the temporal lobes and related structures, and these are the areas of the brain which are most related to memory. Patients with temporal lobe epilepsy often manifest depression, anxiety and social limitations along with the impaired memory, according to studies. By contrast, patients with frontal lobe epilepsy demonstrate cognitive impairment, hyperactivity, obsessive and addictive behaviors. Once again, studies show this. Despite these difficulties, however, many patients perform quite well in life and some show great achievements. We all know that history shows the life of Julius Caesar, Dostoevsky, then Vincent van Gogh, all reportedly suffered from epilepsy. What are the various risk factors which may be associated with epilepsy? Groups that are at risk for other acquired brain disorders, particularly head injury, tumor or stroke, all these people are at higher risk for epilepsy than is the general population. These types of risks which we have just mentioned have also to do with certain other factors like age. A relatively young age for head injury and a relatively advanced age if it is a stroke will have a greater effect. Gender. Men are supposed to be at a higher risk for stroke than are women. And the presence of course, certain medical conditions like hypertension can be a risk factor. Let us now talk about certain psychosocial factors associated with epilepsy. Many centuries ago, people believed that individuals with epilepsy were possessed by a devil, and many of its victims became social outcasts, as shown by the history and which many studies quote. Today, epileptic attacks often arouse fear and horror in the people who witness them, especially as we discuss the tonic-clonic attacks. Epilepsy seems to be related to psychosocial processes in two ways. Let's discuss what these two ways are. First, some evidence suggests that emotional arousal such as anxiety may increase the likelihood of the severity of epileptic episodes. Second, epileptics and their families sometimes adjust poorly to the disorder, especially if the episodes are frequent and severe. These two have been cited in certain studies. Little research has been done on the psychosocial impact of epilepsy, but some evidence which is available suggests that child epileptics suffer reduced self-esteem. Let us try to understand the psychological outcomes also of epilepsy. Many of the adjustment problems that epileptics face can be reduced through counseling. Is there a way out? Yes. Counseling can be helpful. Is there some help which can be offered? We are talking about lowering of the self-esteem, we are talking about increase in the epileptic attacks if there is an emotional arousal or anxiety, and also when the non-adjustment of the family and the individual himself. What can be done? Can something help? In fact, many of the adjustment problems which these epileptics face because of these seizures, they can be reduced through counseling when the epileptic diagnosis is made, and also there are what are called support groups now for every which are formed with respect to the disorder that an individual is facing. So, if once these support groups offer their help, then there can be some improvement in these effects that we have been talking about. What is the treatment then for epilepsy? Most people who are diagnosed with epilepsy and seizure disorders take anti-epileptic drugs. If used as prescribed, if they strictly follow, if the adherence is proper, then these drugs suppress seizures in about 80% of the patients according to studies. When drugs are not successful in controlling the seizures, which is not too often, surgery may be recommended. The most common type of surgery, if surgery is recommended, the most common type of surgery is removal of the focal epileptic area. That is the area where the attacks are known to originate. But this type of surgery can be done only if the area is focal, it is known and is also limited. Thus the seizures must be partial rather than generalized. I hope you understand this, we have discussed about this already. Also, the focal area must be the one that can be removed without major damage to the person's mental faculties otherwise.